My talk on prevention, we've heard a lot about the ACL once it happens and the surgery and the post-op, the complications afterwards. And so we understand the time that the athletes lost. We've got Samaira here as a living example. Time, the cost involved when there's a team and all of that. So going back to prevention is better than cure, something we've been learning since school. And so can ACL prevention be done, and what about it? So I'm going to talk about that. Like I said, I'm not a physio, so I'm going to be slightly more, little medically inclined and slightly more research oriented. Let me know if you have any questions pertaining to those. So majority of the injuries tend to be non-contact, and again, like Samaira very nicely mentioned that, it's a pivoting injury and biomechanics is involved, so we know that. And the cause, whenever we were talking prevention, we got to obviously target the cause of the problem and the risk factors involved. So in the ACL injury, which is a non-contact injury largely, the improper landing biomechanics, deficits in neuromuscular control, and the muscle imbalances are the biggest target area for prevention. Now, all of these, some of these can be modifiable, some non-modifiable. So obviously, let's talk about the modifiable risk factors first. The modifiable risk factors can be internal. So when there is an internal, what happens within the athlete's body, which is largely the biomechanical issues. So the target area for the prevention strategies is technique modification for reducing the loads which go through the knee joint. And obviously, as physios, as exercise science professionals, all of us are largely into how do we increase the muscle support to benefit all of this. And that's where a lot of the intervention, ACL prevention strategies come into play, because it's talking about the neuromuscular training for all of these conditions. So there are many programs over the last more than 3 decades which have been developed in very scientific ways looking at ACL prevention. Some of them are like the FIFA 11 Plus is a little bit more of just knee injury prevention program. A lot of them are ACL specific, ACL prevention programs. Research has shown that if it is a multi-component program rather than a single component, it's far more beneficial, which means multi-component, like it's targeting flexibility, strength, running, plyometric, core, balance, at least couple of these components rather than a single component. Like you can see from some of these common programs, Harmony, PEP, Sports Metrics 11 Plus, these are some of the common programs which are employed and which have been well researched over the last few decades. Strength plyometrics, like you can see, is definitely the common one in all of these programs, and that is quite the basis of the neuromuscular training. Showing some pictures on what are the various types of exercises. Obviously, all of these programs, most of them are freely available online. I'm sure a lot of you are already employing bits and pieces or maybe the entire program by itself. So involving single leg standings in simple ways, adding challenging ways, perturbations. The 11 Plus, like I said, has been, it's undergone a lot of research, modifications, upgradations. It's available online to see. The hip in-outs, a lot of the way the researchers have tried to incorporate this is how can we have these programs incorporated as a warm-up rather than a standalone exercise program so that it becomes more and more acceptable to the athletes. Programs which can be done as groups, because then it becomes part of a thing that is just to be done rather than, oh, a particular athlete has to do this specifically. So program things which involve the athletes' shoulder contacts and working them, and having to work them as teams. Forward, backward hops over lines, cones. Like I said, a lot of these programs, everything is freely available online, and so I'm not going to spend time going through those videos. These pamphlets which are available online, they describe in a lot of detail specifically the points which have to be taken care of while the athlete is exercising, yeah? So doing these drills, because it's quality over quantity, so it's about how these things have to be done. So straight alignment of the hip, knee, foot, maintaining a low center of gravity, lightly flexed knees, soft controlled landing. These are some of the important, what they call internal cues that the athlete has to maintain and keep in mind, so that the exercise drill, the intervention strategy which they are doing is actually beneficial. This is from the Harmony program. The Sports Metrics program as against the Harmony program. Sports Metrics is a program which is developed by Frank Noyes, and his team. Frank Noyes is pretty much the father of ACL surgery. He's an orthopedic surgeon. And his team looks at these cues, which are more of what they call external cues. And again, there has been research which has been done on what do athletes accept better, external versus internal cues, and how does the athlete's psyche also work. So they say that external cues at times work better. So using cues like, landing light as a feather, like rather than just saying soft landing, you use cues like this. Using a shock absorber mechanism, a recoil like a spring. Of course, I think in an Indian setting, if our athletes are not that adept with English, this can be a challenge, and we would, as practitioners, need to convert this into our local language and explain this to them so that this can be used better. So now with all of these programs which are there, there's a very recent, just a 5-month-old meta-analysis which was looking at whether these programs are really effective and do they help reduce the ACL injury risk. They went through a lot of data, and like you can see, there were 10,000 studies which were picked out, and out of which only 11 fit into the criteria of fitting into the meta-analysis. So obviously it was a very thorough thing, and they figured that yes, there were significant positive preventive effects. However, there was no one program which was superior than the other that they found. Another important thing that I felt, which was a critical component from the training point of view, is how each of these programs is carried out. So we know that the program is effective, but how often should it be done? So key elements that they found were, this particular research found, was training for longer than 20 minutes in duration, exercises this entire intervention program when it's done more than twice a week, ensuring variations in the exercise performed, which means you're not training the same components over and over again, stressing again on the fact that it has to be multi-component than just one, providing verbal feedback. So again, that is going to be very important because we want that the athlete carries out the strategy in a particular way, and that's where the biofeedback and all of that comes into play. However, with all of this research on prevention, strategies working, etc., we still do have ACL injuries. So what is the challenge which is there? Obviously, it is the same challenge that happens a lot of the times that most of the physios and all of us see, even me as medical doctor, we see it in our clinics, that there's patient compliance or athlete compliance. So the same thing, that when you're going to ask somebody to do a program when the problem has not even occurred, okay? So once the ACL happens and the person has to do a rehab, the compliance is going to be better than when you're asking them to do something just so that they can prevent an injury. So compliance is an issue. The exercise needs to be performed consistently for it to be beneficial. It's not going to be helpful if they've done it for 1 month. It's not going to help them for the rest of the season. Athletes perceive these exercises as boring often. And then the next two most important things, that who is going to be the facilitator for these prevention strategies? Is it going to be the physio, the athletic trainer, some other professional, or is it going to be the coach? So again, research which has been done around this says that if we manage to get the coach buy-in, I think rightly, like Nilesh mentioned, that when we are working in a sports setting, to have the coach by your side is the most important. So if we have the coach buy-in for this, then studies which had the coach buy-in, their results were significant, with almost 50% drop in the ACL rates, ACL injury rates at 1 year, 2 year gaps. One thing that I found very interesting in this whole aspect was that there was a study, there's a particular author, Grooms, who looks at a lot of functional MRIs, pre and post training, and they found that actually when there was a decrease in hip adduction and knee rotation, that was associated with decreased motor cortex activity of the brain. So the motor cortex is from where we actually do conscious activities. A decrease in motor cortex activity, which means that the athletes who were trained now in these interventions were actually working from a little subconscious level type of a thing, and they were able to translate their practices onto the sporting environment very seamlessly. So I think that means that it's not only really working from the neuromuscular point of view, just from the joint aspect, but even at a higher level. Going to the last modifiable risk factor, which syncs up with this aspect of functional MRI, and this is the athlete perception, increasing in the athlete perception and fatigue and psychology. What I mean by this is that the ACL injuries have again been tied up to a deficit or delay in attentional processing. When this is there, the athlete has an inability to correctly position himself or do coordination movements. So this ties up with when an athlete is fatigued, the chances that he's going to be able to intervene and take the right decisions, take the right footstep is going to be lesser. So that's where I think a lot of the sports science environment comes in, that we look at the duration of game, what is the athlete workload, is the athlete slept better, how is his recovery, all of those things also have a role to play. And from the psych point of view, when there were high levels of personal and sports-related stress also, injuries were known to be higher. So that's where I think the psychology colleagues would come into play. External risk factors of shoes and pitch, massive topic, I'm not going to touch into it, but yes, when there is excess friction between the shoe and the playing field, ACL injuries are higher, and this can be an intervention area. Among the non-modifiable risk factors is the bony morphology, which is non-modifiable, which means we cannot really change it. But where this comes in is that because females are known to have higher ACL injuries, because they have this typical bony morphology probably, and also a hormonal aspect, intervening with hormones has not really shown any definitive research. So, giving them any oral contraceptive pills or any hormones has not shown to be beneficial in reducing the injuries. But the research should, and the further industry should focus on maybe everything from smaller ball sizes, customized footwear, etc. for females, so that the injury rates can be lesser. Finally, while we are looking at ACL prevention, identification of at-risk individuals, it has been not cost-effective to screen athletes for susceptibility. So it has been suggested that ACL prevention should be mass rather than screening athletes, that who is most susceptible, because one, there's no definitive screening, and if there is a definitive screening, it's not necessary that this will only work. So it's better to just employ it in everyone. But where we can look at risk individuals is the younger age group, sports specific, so sports which are at a higher risk of ACL injuries, and obviously the female gender, so female specific, because that can be a high risk group. Finally, I'd like to end the talk with artificial intelligence tools. So that is coming up now in, again, identification of at-risk. So this is obviously going to be the future. But as of now, there isn't enough research to support it again. As far as prevention is concerned, I know that in other areas also this can be utilized, but nothing for now as far as prevention. But we all need to keep our eyes open, because this could be the future. So take-home message would be, whether you work with a team or you work in a clinical setting, if you have identified an athlete who can be at risk from the point of view of, their sport, female gender, or the age-wise, the athlete is receptive, the support team is receptive to exercise, doing an intervention for ACL prevention, take the opportunity to give this particular intervention. Thank you.
Thank you.